learning techniques and coping skills.
My organization, we actually have housed people for 8, 9, 10 years at a time. Not because they weren't ready or irresponsible or anything like that, but it has been around and it's been a proven practice of those that have lived through an addiction as a stepping stone, as a means of support. So that's what recovery housing or step-down housing does. It's been around since the 1800s. It's not a new concept, but most of the results are the long-term recovery results that everybody's looking for in addiction.
I have a success story of a man who came into the service to work with us here at the hospital, and he recovered. It's been almost 2 years ago now, and he has continually called in about every 2 months to give us a report and an update that he has now become a peer support for other people, and he continues to encourage people to go through treatment and understand how much his life has changed, and he is a beacon of hope.
Heroin use, as well as other illegal drugs, is a serious problem in our state.
We can all do something about it.
Life is too precious to risk it on drug use that does more harm than good.
Become a positive force in your school, in your neighborhood, and among your friends.
When Governor Kasich took office, one of the first things he did was establish the Governor's Cabinet Opiate Action Team. And the purpose of that was to take leaders from state agencies, Job and Family Services, Department of Health, Medicaid, Department of Mental Health and Addiction Services, and say, clearly we have a problem. How are we going to address it from each one of these state systems? The other thing that he did, aside from pulling that cabinet together, was he started a program called Start Talking. And the goal of this program is to decrease the number of people who ever become addicted by using prevention services. And those prevention services are simply to have conversations with young people about the very real disease of addiction, and to set them up with resiliency factors so that they never become addicted to begin with. We know the younger you start talking to young people about the realities of drug abuse and drug addiction, that it is not a moral issue or a moral deficit, but a disease, the less likely they are to ever become addicted.
And we also want to focus on prevention so that we can prevent those folks needing treatment or even having the challenges. And further, we believe in long-term recovery that requires the appropriate recovery supports, including housing and all the AA groups and everything, to make sure that folks can get all the supports they need to really succeed in recovery.
When I first heard the word ACEs, I was thinking about, oh, we're going to play cards. This is a card game. Well, it wasn't. It was an acronym that stood for Adverse Childhood Experiences. That intrigued me as a superintendent. So as I looked into the ACEs study, realizing the number of adverse experiences that our children can experience in growing up, and the adverse effect it has on their health, on their education, on their behavior, and quite frankly on their future lives, was astounding. And so the first thing for us was becoming aware of what ACEs was about, becoming aware of these experiences that our children go through. They're the silent minority, quite frankly, of some of the things that happen. So we've really taken off on this ACEs piece. We've introduced it to our entire staff. Again, information is power. And once you begin to realize the importance of what goes on before they walk in our doors and how it can affect students, I think you then take over the power of being able to help them cope and deal with those kinds of experiences. We've done some things locally with our staff dealing with ACEs. We have a number of different buildings where we see a higher propensity for students who walk through our doors with issues, and they're doing some book studies. Again, we're using the positive behavioral instructional model. We're using a second steps approach. It's a social and emotional curriculum. We've also saw the importance enough that we've hired 3 social workers in the district to work specifically at our elementary levels. You know, we have guidance counselors at the middle school and the high school, but we've had very little support at the elementary level, and realizing that, we have implemented those social workers with really a targeted focus on meeting with students, meeting with groups of students, working towards connecting families to getting help and support.
If someone is looking to get help, whether that's with providing prevention education or treatment for an individual, either for a family member, friend, or themselves, we have a bridge line that's toll-free that they can contact on the state level. The other thing I recommend is getting in contact with the local alcohol, drug, and mental health board within your county, because they have prevention and treatment services that are much more readily available. They're going to know what's in your community. They also may know what your specific need is and link you to it much sooner.
Heroin is not something you want to experiment with. Don't even try it. Right now, the national average is under 5% of folks that even try heroin for the first time ever fully recover.
Young people think they're invincible. They can drive as fast as they want without seatbelts. They can do strange things on skateboards and think they're invincible. They can also take a certain pill and think they'll be fine and they can handle it. If they realized the eventual path that this leads, the pills lead to heroin, heroin leads to a burial. I've told some young people that they may want to take their parents and go to the funeral home and pick out a casket ahead of time because that's where it leads.
Our government is seeing it. There are lots of people like myself who are on the phone and sending emails and sending letters and going to DC and calling out our government that, you know, this is an epidemic and it needs to be treated as such. And stuff is happening.
The disease of addiction is very stealth, it's very opportunistic, but it certainly can be prevented. One, again, if we educate ourselves on understanding what it is, but two, if we also understand that everybody kind of has their own unique journey, and we're there to not just observe it, but sometimes to support them, especially in the process of recovery.